We're very happy with the Lumenis SLT. The unit is compact, it's quiet, it hooks up to a Hogstrite style slit lamp. We had an extra one hanging around and it was easy to hook it up. It happens to be the slit lamp that I'm most comfortable in. So from a usability standpoint, I'm happy that I'm already using equipment with which I'm comfortable. What I would tell any new prospective buyer in whether to consider SLT is to avoid the mistake that caused me to be on the sidelines for 10 years. Don't look at how many patients would be argon laser trabeculoplasty candidates. Rather look at how many patients in your practice have glaucoma on a weekly basis. And that should be the driving number.
I think the biggest recommendation is that it works, and the people come back and they're very satisfied with their outcomes. They're having very large pressure drops, so they feel comfortable and confident in not only in the laser but in you, and I think it really kind of builds your physician-patient relationship. So again, I use the word efficacious. It does what it says it's going to do, and the results are pleasing for both the patient and the physician. Well, and I have talked to a few of those colleagues and called them up and tell them just take the leap. You're never going to look back. You're never going to second guess yourself. Once you start using it and once you start getting the results it provides and the patient satisfaction, you'll never think that you made the wrong decision. I've always said to every ophthalmologist considering buying this SLT laser is if you're treating glaucoma, you need to have an SLT laser, period. Probably the best thing to do is just get education, maybe talk to an ophthalmologist like myself, a general ophthalmologist who treats a lot of glaucoma, and just get a better lay of the land, or come into their office and give it a try on some of their glaucoma patients and see the results and get some confidence with the laser. But I think once they do that, they'll certainly go ahead and buy a laser. I've been a strong supporter of the SLT laser. Just this morning I scheduled 2 cases before I came in and did this. So anyone who's unsure, just to give it a try, give somebody a call who owns one. It's great to have in your office. I schedule it all week long, and the patient convenience wonderful. It saves them money by not having to go to a surgical facility or hospital to have it done. I think it's a good marketing idea for your practice to grow your practice. And again, you're going to pay for it in the first 6 to 12 months.
Well, if somebody was interested in acquiring the laser, I would suggest to them, number one, to do their homework. And that homework would include looking at peer-reviewed literature, discussing the laser with doctors that have already implemented it in their practice and get their clinical experience. And also, of course, and I think just as important, speaking to our friends at Lumenis, who will help guide them and make sure that their results are excellent. I look at Lumenis both on the research and development side as well as on the sales side as partners, and a wraparound with myself, with the patient in the center. And I really believe that. I know many people at Lumenis now. I've been to their research and development lab in Utah, and I believe that these are excellent scientists, clinicians, and salespeople that really care about the success of the laser in clinical practice. And I believe that what my colleagues will find after they look at the data and after they have the appropriate conversations, they'll find just what we did, that the laser was incredibly beneficial, not only for the clinical aspects and the excellent efficacy that it's demonstrated, but also for return on investment. And when I say ROI, I mean not only for us as a practice and small business, but also for our patients and cost savings, again, for pharmaceutical products. So I think for us the proof is in the pudding. We now have 3 Lumenis lasers in our practice, and I believe my friends and colleagues, after they do their homework, will find the same thing.
I would strongly recommend SLT. I'm a fervent fan of SLT. In my opinion, it is the way to treat glaucoma. It is incredibly safe. It's very easy for the patient to go through. it works, and it works well, especially in a primary therapy role. I've seen significant drops in IOP that have been maintained for several years, and that's a huge savings for the patient as far as expense that they've had to invest in drops month to month. I get tighter IOP control that's stable, that we don't have the missed drops and I ran out of my refills, etc., where patients come off medication. So the glaucoma is better control. Just kind of off the cuff, comparing my patients on medicine, my patients who have been treated with SLT, and my SLT patients convert to progressive glaucoma at a far lesser rate than my patients who are on medical therapy. I tell them it's worth it. It's an expensive machine, certainly, but like I said, by having the machine with you in office, your case numbers will increase, and I think that you'd see enough numbers coming through that you would offset that initial expenditure, and probably within a short period of time be able to get out from underneath the expense of the machine.
To a friend or any other, any colleague ophthalmologist, I know that they have the same problems that we have with managing patients on eye drops and not knowing if they're getting them in their eyes regularly, etc. So this is probably, in terms of compliance and side effects, the easiest way to lower the pressure in the 75% of patients that it works in. And I repeat, I would not care to manage glaucoma without this procedure available. I've actually talked to a number of people in that situation, and their concerns are usually related to, does it work? And I don't think, I now feel that done properly, it really works in the majority of patients.